Hello, my name is Laura Castle, and I'm going to be presenting my A&P paper that we just completed. This is the PowerPoint I created. The title I chose was "An Ounce of Prevention is Worth a Pound of Cure" because my topic was preventative mental health care delivery. So I kind of narrowed it down to mental health because I'm going into the psychiatric mental health nurse practitioner program. So I kind of wanted to tailor it to what I was particularly doing. There's three different levels of preventative healthcare delivery. The first one is primary prevention. And the goal of primary prevention is to actually reduce the onset of the illness. And ways that we can do that are identifying people that have the risk factors for developing mental health disorders. The secondary prevention is the next level, and that's aimed at lowering the number of individuals in our community that have mental health diseases or illness. And a way to be able to target that problem is early diagnosis and treatment. The third level is tertiary prevention, and that's aimed at reducing disability, enhancing the rehabilitation, and making sure that we prevent any relapses that they may have about their mental illness, making sure that they're staying well treated and mentally healthy. Okay, there are some challenges, though, to delivering mental health care, and these are a few of those. Providing interventions early to prevent the onset, and sometimes it's hard to catch people early for lots of different reasons. Maybe the stigma of, actually going to the doctor. Maybe they have financial or insurance problems to be able to get the doctor, things like that. Lack of proven evidence-based preventive measures, and that's something I found out through research. Even though we kind of have an idea of things we think would work, for preventative mental health, it hasn't been actually backed up by that evidence that we like as practitioners and professionals to say that this is definitely what we need to do. This works. It's researched, and we found this to be effective. So more needs to be done in that area. Living in rural areas, we know that the farther that you are away from providers, and we have less providers in rural areas, so that's a really big challenge to give people care. Stigma, there's also some stigma related to going, to receive care. People don't want to admit that they have a problem, whether it's, it can be, inflicted personally. They personally have a stigma about going, because of how they feel about mental health, or maybe people in their family, or just what they think community members might think of them for having a mental health disorder and having to seek help for that. And next is the plan to improve preventative mental health delivery. And I've listed it in the primary, secondary, and tertiary levels as far as different things that we can do to make sure that we improve that in our communities. So the primary things that you could do are patient education on these different things. So to prevent the onset of any illness, we need to teach coping skills, give information on coping skills, stress management, emotional self-regulation. How do you control it when you have emotions? How do you handle it? How do you deal with it effectively? And then proper nutrition, sleep, and exercise. Making sure that we eat healthy diet, we're getting that 8 hours of sleep, we're having regular exercise. All those things can help prevent the onset of mental health. Secondary, we want to make sure that we are doing mental health screenings, because this is going to, we're going to decrease the number of mental health people that we have, or people that have problems, mental health or illness within our community. So to decrease that number, we want to do mental health screenings to try to catch the people that do have problems. Cognitive behavioral strategies, psychotherapy, pharmacotherapy, and these are things that we can all do whenever we identify them, or whenever we know that they need treatment. These are ways that we can get them help as professionals and practitioners. Tertiary is the third level, and we want to encourage that compliance. We have to really stress how important it is that they take their medication, that they come to their therapy sessions. It's so critically important, and especially mental health, where people, when they feel better, they want to stop taking medications and they want to stop going to their therapy sessions. So we need to make sure that they we try as much as we can to encourage that compliance. The next is telehealth is another strategy that we can use to help this mental health delivery. If people in rural areas, another way to be able to, get them to be seen in a visit is by setting up telehealth appointments. So that could be very helpful. There needs to be more research in evidence-based practice. What can we do? What do we need to make sure that we're using strategies and techniques that are actually effective, and research that. The next point is a multidisciplinary approach that is tailored to each individual. So everybody's different. Their mental health is different. They may need more support. This one may need actual supportive therapy. This one may only need medication. Maybe they need to be referred out for other things that with people that you collaborate with. So the fact that we're multidisciplinary, we can coordinate with other providers, that's going to be key in helping to, administer this mental health care that we want to get out to the community. The next is normalizing annual mental health exams. I think that would be a great way to help decrease the mental health issues in our communities. Just make it a yearly exam, just like we get our physical exam, we could get our mental health exam, and to normalize, the importance of that and people coming in for it. Maybe making sure to support lobbying that helps the insurance to pay for that and make that a normal thing and be paid for by insurance. That would help, the different areas, especially primary and secondary preventive healthcare delivery that I previously discussed. And the two questions that I have for future discussion, the first one is, how can psychiatric mental health nurse practitioners overcome social determinants of health? And here I'm talking about like poverty, hunger, homelessness, discrimination, these types of things. Question number two is, how can psychiatric mental health nurse practitioners assist in effectively integrating mental health prevention into primary care settings? Because there seems to be a lot of focus more on the physical health than the mental health. So we need to help pull in those primary care providers. How can we do that? What are some good strategies for that? So there's my two questions, and that's my presentation. So nice to see everybody. I'll see you later.